Dear ladies and gentlemen, Ramadan Kareem, as we are reaching the final days of Ramadan and approaching to the Eid very fast, we are so excited and honored to host Dr. Sanabel Al Akras today in our Ramadan talks, which is actually the end of Design Post-COVID Humanity, Ta'aruf, Ta'awun, and Tarahum program. And let me briefly introduce you, Dr. Al Akras. She is a general psychiatrist who graduated from Weill Cornell Medical College in Qatar in 2012. She has also managed to experience the practice of medicine in different parts of the world, such as Tanzania, where she had volunteered there for some time as well. She has a special vision and interest in fighting the stigma towards mental health, as well as prevention of mental illness, starting early in childhood. To go forward with her vision, she targeted that by trying to change the parenting styles being followed and how parents perceive their children. She has founded Cuddle Castle Nursery in 2015 and trained a specialized team there to implement the Montessori curriculum, which proved to be the best to raise children with balanced mental health and leadership skills. She has recently founded El Sanabel Specialized Psychiatric Center in 2020 in Qatar, trying to create a remarkable service in the mental health in Qatar with very high standards of care by adhering to the international guidelines in mental health, as well as introducing all treatment modalities in psychiatry. And she's an alumni of Qatar Foundation, and also we share a lot in commonality. I can easily see that as the founder and designer of Design Post-COVID Humanity, I'm really very happy to see that there's actually a great contribution coming from alumni of Education City in such an important and sensitive area. So without further ado, Dr. Sanabel, the floor is yours. And if you want to share your screen, please kindly proceed. And I believe you have around 15 to 20 minutes or up to you for your presentation. Around that?
I think 18 minutes, yeah.
18 minutes is perfect. And then afterwards, we'll open the floor for Q&A. And their audience and everyone who is watching us or listening to us, please enjoy.
Thank you so much. Thank you for the very nice introduction. So I don't really have slides. I usually like the talks to be interactive. And so the topic I choose to talk about is how do you know how far you will go? And so this talk mainly would be targeted toward young students, young employees, people who are just starting their careers, and about the disappointments that they might find or the challenges, and how can they overcome these. Because I only have 18 minutes, so I'm just gonna, and I'm a psychiatrist, psychiatrists speak so much. If you care, I can keep talking for 2 hours if you're able to do that. So I only chose like 5 main points that I feel those are the ones that really helped me. I think I learned that the hard way, and that's why I'm all the time, whenever I meet anybody who's still new or young in their career or college, specifically in the Education City, I will go ahead and just burp whatever I have. So first of all, I'm a graduate of Weill Cornell Medical College. And as you all know, probably, that in Education City, it's kind of a closed community. It's a very distinguished closed community. So what usually happens when we leave Education City is you face the real life, you face the real world, you face the real challenges, right? And you'll be alone because usually we're very well supported in the education city and in our colleges. So those are one of the challenges that we face when we go outside. So the first thing I would say, and that's coming from the fact that usually the colleges in education city, they choose the best of the best, whether they're choosing students or they're choosing staff and employees, right? So you were the best in whatever environment you were in. And then you were transferred to a place where everybody around you, they're the best of the places where they were in there, right? So the kind of competition is different. And so there where it comes and you might pump into, I'm not good enough, I'm not doing as well as before, there are a lot of people doing better than me, and all of these doubts where you start to question yourself. And my message would be not to be harsh on yourself, because again, always remember that all colleges and universities in education city, they choose the best of the best. So you're basically competing, or you're working, or you're studying with people who are basically the same as your level outside, right? So that's the first thing. Now, what the first message that I would deliver is that you have to explore your own strengths and your own weaknesses. You don't have to put yourself always in the group. It's always good to be in a group because that makes it very supportive. But again, sometimes, specifically with going through specific tracks, going through specific, that you have to finish this in this specific time, you have to do the exam with the rest of your colleagues, you have to finish your project or your thesis or whatever you required from you with the rest of the group. That sometimes pressurize some people, pressurize some students, because all of us are different. Some of us are better learners, visual learners. Some of us, we learn more by lectures, listening to the lectures. Some of us, we need hand-on experiences. And some of us actually may have specific challenges like ADHD. And nowadays, and I really want to mention that some people who have high IQ, or like they're smart enough to compensate for the requirements they had during schools, they actually start to experience the ADHD symptoms once they reach the college time, because in college the challenges is much more. Probably at that time they also have a family, they have kids, so there are a lot of responsibilities that they have to keep track on. So that's the time they realize that I am having a problem, right? So my point is, you have to know what suits you. So even if the college, for example, is asking you, you have to finish, like for example, in my college, you have to finish USMLE step 1 in a specific track. Like you have to finish it, I think, as I remember, before year 1 or year 2, mid school. Now, if you feel you're not ready for that, if you feel, for example, this study break is not enough for you, and this exam is not something you can repeat, or this is something that's going to stick with you for the rest of your life, you don't have to push yourself to do it just because you want to be with the group, just because I want to graduate with my batch or my class. Okay, I want you to think in a bigger and wider picture, that college is only a transitional point to real life, to the real challenge outside. So the college is preparing you to the challenge that is going to happen outside. So don't lose yourself between, all this competition or pressure or anything, just because you want to stay with the group, you want to stay with the patch, you don't want somebody tell you that, oh, you're late, you didn't graduate the same year. Oh, I don't know what, many things that we might hear through your path in college. So you have to explore yourself based on your own strengths, your own weaknesses, and you put your own track. okay? Because why am I saying this? Because your career is one of the things that's gonna stay with you probably longer than your family, okay? So this is something that's gonna stick with you for a long time. So don't let anything pressurize you to push you into specializing in something that you don't want, or go into a college that you don't wanna be there. Or for example, choose something like I'm in love with medicine, or usually it's the opposite, vice versa. All our families, they want us all to be doctors and engineers, right? While basically, if you think about it, if all the world became doctors and engineers, then the world is going to fall down, because every single career, every single study or education is needed, right? The world cannot live only depending on only two careers, right? So that's what I'm trying to say. Now, number two, my advice would be to create your own bubble. Now, what does it mean to create your own bubble? So this point is kind of related to the previous one. My own bubble, it means you're able to filter whatever you're hearing from outside. I understand that when we were in our like 18, 19, 20s, you'll be much more, might be easily influenced by your friends, your family, people around you, than, for example, when you're 30, because basically the track of your life in your mind is not as clear as when you get older. So what I want you to do is always try to bring yourself back to your main goal. Why did you want to study medicine in the first place? Why did you want to be an engineer? Why did you want to go into Carnegie Mellon? Why did you want to do a master in, for example, clinical psychology or higher Islamic studies, right? So you always, because during the way, you might lose that, okay? It's actually most of the time we forget why. Why did we choose this in the first place? Now, this is one of the things that actually made me take a leave of absence during my college education and go to Tanzania and volunteer in one of the hospitals there that they really have very low resources. So I really needed to connect with myself again to remind myself, why did I choose medicine in the first place, right? So if you feel you need to do that because you lost it at some point, different things can affect that, actually. The fact that you're in college, one of the best colleges, the people around you are one of the best people. They're very talented, they're very smart, and all of these things. Competition will drag you there. So instead of you would be able to see the whole picture from outside, that I'm going to be an independent practitioner sometime, you forget, you start to think only about, I'm evaluating myself only based on this exam, or based on this test, or based on this prelim, right? So that's when we start to build up the negative thoughts about ourselves, that I'm not enough, I cannot do it, this is not fixable. If I get a bad grade in this exam, this is not fixable, I'm the worst in the college, and all of these automatic negative thoughts. This is something we call in psychology/psychiatry, okay? Now, that's what you need to protect yourself from. So if you feel at any point that you lost your way during your education, you forgot why did you choose that specialty in the first place, then you need to disconnect, create your own bubble at that time, and then go back to whatever you were doing, okay? So that's the time, as I told you, I went to Tanzania. So you see people where they really need excessive help. You don't have a lot of resources, so you really need to depend on your clinical judgment and all the basics that you learned in college. The happiness that you see in somebody's eyes, despite that you were a medical student, but they're so appreciating you, that is reminded me of why did I choose medicine in the first place. I was looking for this. I was looking for that spark in the patient's eyes when you're able to help them. And that's actually what happened. So my self-confidence built so much. I totally connected back with why did I choose medicine and all of these things, because that's your passion is actually what gives you the power to continue in the difficult programs, because you need that passion to make you go the extra mile to continue in that kind of education and that kind of competition. So that's what I mean by create your own bubble. You don't have to receive all kind of stimulants and advices and all of these things. It's okay to listen to them, but you have to filter them. You have to accept what connects with you deep inside, what clicks with you. So number 3, my advice would be, if the path of your career, if you imagine it's a video game, okay? Let's imagine that it's a video game, that where you have to finish high school, and then level number 2, you have to finish college. In some colleges, actually, there are not more than one level. And then level 3 will be like to go into your training or internship or whatever your college, or like your research, thesis, and all of these things. And then number 4 would be, level 4 would be like to find a good job opportunity and all of these things. So if you imagine that it's a video game, right? There are levels. Sometimes actually we trap ourselves in level 1 because we're just not able to see the picture from outside, right? So that's why I want you always to imagine it's a video game. Of course, you can imagine something else if you're not like a video game person. But I chose that example because most of the people that I see, even in clinic or in my social life, they are into video games, whether they're like young or old. So that's why I chose that example. So don't trap yourself in level 1, which is either the, in our situation, it's going to be like the college time, right? So it doesn't mean your grades were average, or your grades, you were not on the honor list, or you, for example, did not pass in one of your tests in school, and then you had to remediate it, that you're not going to have a good future in your career, okay? I always tell, whenever I have like students or something, I always tell them, always remember in any career, what is very, very important is the passion to that career, and that you are ready to go that extra mile to read when you're not sure of something. So knowledge is always there, right? So now if you notice, even us doctors, there is no way I can have all of these medications inside my mind, right? And that's why actually we specialize, because there is no one brain, human brain, that can have or collect all these specializations together. So I cannot be a psychiatrist and a cardiologist and a nephrologist and an internist all at the same time, because it's a very human being is one of the, it's actually the most complicated, thing in life. So our human mind cannot collect and have all of these information in our mind like that in detail. So that's why actually we specialize, right? So we only focus on whatever my specialty is. It's it doesn't mean whatever is happening in college, if you have the passion to go further and to be persistent and to wanting deeply to finish what you want to finish and succeed, you are going to succeed. Okay, because knowledge comes. You can always read new studies. You can always read textbooks. You can always go back to any kind of applications to check what's the half-life of this medication or something. But the basics, that's what you want to learn in college, right? And it's a funny thing that happened actually with me when we usually graduate. And I think most of medical students, I don't know if any of them here, but most of us as many medical students, once we finish medical school, like, oh yeah, I am the doctor now. I know everything. I am like, I can treat anyone now. And then when we do our internship, that's when we get the first shock. I'm like, OMG, I have no idea about what is happening in these rounds or what is happening with this patient. So we finish our internship and we start our residency. And that's when you start to see actually complicated cases, right? And that's the time we're like, I'm not going to spend the rest of my life like this. I can't do this. Now you start again doubting yourself, right? And then after your residency, that's like 5 years probably after your graduation, that's when you start to feel that, okay, I am now close to being a doctor, right? So now you're thinking in like let's say you're more connected to reality, okay? So it's fine, it's okay. Why am I telling you this? Because it's totally fine to feel this way once you start your career and once you start your practical life. It's normal to feel this way because studying the basics and the concepts is very different when you're actually trying to apply it on people and really human beings, and get into the details and try to connect the puzzle all together. And I think that fits with all most of the majors that are there in the education city. Okay, so don't make yourself stuck in level 1. Okay, college is just a transitional point, just one level of your life. Okay, just get whatever you can get from there. Okay, and you will continue working on yourself. Never think that once you graduate, you're never gonna read any book. You're never gonna read any study. I'm never gonna be get any more training. No. This is like I'm telling you, career is gonna stay with you longer than even your wife or your children. Okay, it's something stuck to you for the rest of your life. So you have to choose something you like. You have to choose something you cannot imagine yourself. You can live without it. Okay, don't get stuck. It's okay. I was an average student. I was not the best. Okay, I got honors in one of the like specific things that I really loved, but I was not like on the dean list. I was not like the smartest student in college, right? And here I am. I found myself very successful in practical life. Okay, because again, it takes passion and it takes personality. Knowledge, you can always build it. Okay. So don't worry, it's fine. Don't lose hope if you didn't do well in one of your topics or one of your subjects in college. Just do your best and forget the results. Just do your best. The results is God business. Our business is doing our best, doing what we're supposed to do, right? And then the result is God business, as I said. The other thing is, don't be cruel to yourself. Don't keep, as I said, anything can be compensated. Money can be compensated. A grade can be compensated. A relationship can be compensated. Your mental health cannot be compensated, right? If we get stuck in depression, if we get stuck into wanting to commit suicide, for example, during college time because we're not doing well, or I'm doubting myself, or I'm not able to impress my parents, by the way, because that's a big problem also for students. The fact that parents have usually high expectations from their children, and they're evaluating their sons and daughters based on their grades, not based on their efforts. And I always tell parents, if any of you is a parent here, you have to evaluate your children, your adolescents, your sons and daughters based on the efforts they put into something. You have to give them credit for that, even if they're not able to get that credit, that grade that you were putting in mind. Because it means a lot for children to impress their parents. I face a lot of cases where the main reason of depression or the OCD, obsessive compulsive disorder, or even the suicidal ideation is because simply they're not able to impress their parents, right? They wouldn't know this. So the real pain here is that they don't really know what's wrong unless once we start going into psychotherapy or we talk a lot and more, and then that's the time where we pinpoint the problem. They face a lot of criticism at home. They face a lot of, you cannot imagine what does it mean, a son or a daughter in college, and they have to hide their grade from their parents because they just don't want to hear the criticism, right? We're not in school anymore. We should be, as parents, once our children gets into college, we should always support them, right? It's their life at that point. You just have to support them, whatever they get. You encourage them, but don't let them feel that they're a failure to you, that you're not happy having them. You're regretting having them. You wish if you had the other student or their cousin or their brother or sister. Like, that drives me crazy when I hear from them saying this to me. Now, parents, we always do these mistakes with good intentions, okay? So always our intention is good, but sometimes the style we use it with our children, we're destroying them rather than building them. And as soon as I call the parents, for example, and I tell them that this is a situation and we're having this, you'll see them started to cry because they never imagined that parenting style or the way they're dealing with their son or daughter can actually lead to suicidal attempts or committing suicide or getting stuck in depression or them deciding out of a sudden that I just don't want to continue in this college. Okay, they're escaping that. The final point, I think I'm on time so far, right?
Yes, you're on time. You're perfect on time. Yes, excellent.
Yeah, perfect. So my last point is that success is a decision. It's not a result of something. It's really a decision. If you take a decision that I'm going to succeed in this, you're going to succeed in this. It's not a result of your grades or blah, 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 all of these things. So I'm going to tell you a story. Always, your success will not happen if you're always in your comfort zone, okay? Because we're human beings. There always have to be motives to push us forward, right? Either the healthy anxiety. Yeah, there is healthy anxiety, by the way. There is healthy anxiety. That healthy anxiety is what pushes you to start studying for the medication, for the exam, one week before, okay? So we call it healthy anxiety because it pushes you to do something, but it does not impair your function, right? So it's always some experiences we pass through are really painful to us. But then when you think about it later on, like 5 years, 10 years later, you could find yourself telling yourself, if I did not pass, and you have a good insight, if you did not pass through that painful experience, you actually would not go to the next step, which actually shaped all your successful path or career, okay? That applies sometimes, by the way, with relationships. If I didn't have that painful relationship with that somebody, I would not be cautious enough or aware enough to make a good choice with the next relationship, right? This applies to so many things. Pain usually either it will bring the best in you or it will bring the worst in you. What decides this is your reaction to that pain. It's how you perceive that pain and how you take that experience, you embrace it, and you take your decision where you're going to go. Is it going to bring the best out of you, or is it going to get the worst out of you, right? So that's why I'm saying it's actually success is a decision and it's not a result of something, okay? I might be the worst student in college and I woke up in the last year of college, right? Does this mean I cannot, for example, just graduate and do a master and do a PhD and then do something else? Or even if I felt that I didn't like my major, does this mean I cannot just go to another major? I'll tell you another thing, funny. So we finished from Cornell and we always kind of young because we get there 17, 18 years old. We graduate like we're 24, 23 years old. So we go to do our training in USA. And we start to get to know the other like residents like us who are specializing. And you discover that you are the youngest actually in this hospital. And at that point, life stops there because you were burying yourself for the past 6 years. You were not having any fun. You were not seeing your family. You were not focusing on anything other than having good grades and graduating. And then at the other, at the other side of the world, you find people who are like actually 33, 34 years old, and they're still medical students. They're just starting. So that's where your life stops. You're like, why? What is this Harry? Who was following me? Like, why did I just stop and do whatever I want and explore myself and do all of these things? That's actually when I didn't regret that I took a leave of absence and I went to Tanzania and I explored another part of the world at that point. Okay, so that's where creating your own bubble makes sense. Don't always put yourself in the group. I have to be in the group. I have to be with the team. I have to be with the whatever box they're drawing it for me. So you draw your own box. Okay. I'm gonna tell you something. That's the last example, I promise. Okay. How pain can create something good. So at Sanabel Center, I always knew that I will go to private. So I worked in HMC almost 8 years. And I always knew that I'm going to do that step one day, but I don't know when. Okay, so I was waiting until I was feeling that I'm ready and everything. And I had the budget ready. I have everything, but the budget was on a much bigger scale. So it was like so expensive. So I needed like to spend more years to collect money and stuff and be able to do it. Now, what happened in my second year fellowship, so I was doing the subspecialty. So I finished my specialty in psychiatry and I was doing my subspecialty. In my second year's fellowship, I was the chief fellow. So I used to attend also a lot of administrative meetings and all of these things. And that's when actually the clash happened. I started to clash with one of my seniors, and I'm not going to go into details, but I was always defending the people who I'm leading, which are the other fellows, right? And in medicine, you will always find this. It's like military. Hierarchy makes it's a big thing in medicine, okay? You always have to respect it and everything and blah, 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 and all of these things. Because so I was defending those people and I had to clash with the higher people. And that's the time where one of them told me, actually, I think you have behavioral issues. And I think I should refer you to cognitive behavioral therapy. And that drove me crazy. Because at that point, I knew that something in my personality is being exposed when it should not be exposed. So I went into a workshop that actually Cornell offered us that on how to be a good leader, how to be a successful leader. It's advanced leadership, something. I forgot what's the last was it. But it teaches you how to be composed all the time, how to, I wouldn't say manipulate. It's actually manipulation, but in a good way, like for a good goal at the end, okay? But how to express your opinion in meetings without losing yourself, without letting your passion push you to show something that should not be shown in similar meetings, right? So I knew I was right at that point. I knew there was unfairness happening there, and that's why that person took it against me. And I remember very well at that day, I went back home and I'm like, I am going to do my own thing now. It has to work. That night, I did not sleep. I spent the whole night trying to downscale the budget I had already there. And I kept downscaling it. I kept downscaling it until I was able to reach the amount of money that I could do that project in 1 month or 2 months. Okay. And I spoke with my father. I spoke with the rest of our partners, and they already had an experience with me with Kadil Castle Nursery. So they know I kind of have a good business brain somehow. So they trusted me and they're like, okay, go ahead. So in 1 month, I resigned. I started the licensing process and everything. And the second risky decision was when I decided to open, because I just couldn't stay at home for 3 months without seeing patients. I was going crazy. I can't, it was a waiting. I can't do that. So I opened in Corona. I opened, we launched the center in July. It was like in middle of Corona. And everybody was very, very, very afraid of the decision. And it went very fine. Actually, I realized that I opened in the right time, because you know how like the pandemic inflicted really badly on our mental health and all of these issues, and people needed support and people needed a second place to go to as well. So pain always brings success. It's just you have to decide if this pain is going to bring the best of you or the worst of you. Okay, so that's it. I think I'm done. I hope I didn't bore you guys. And that's it from me.
Thank you so much, Dr. Sanabel. This was really fantastic, and I'm sure that the audience would join me in giving you a huge applause actually for your accomplishments and for your motivation, and also your enthusiasm in conveying this motivation to the rest of the world. So without further ado, for the sake of time, I would like to actually invite the colleagues who would like to raise some questions, and but in general, their audience, please, if you can, keep your questions precise and to the point, just for us to stay within the 1 hour time limitation. There's Zinat, I see your hand.
Yeah.
Do you have a question, or are you just stretching?
No. Okay, thank you for this informative and really nice presentation. And I'm interested in the parents section where dealing with the children, because I have a daughter and I passed in the same process what you have told, but I changed because I was learning a lot. But you presented the dilemma, but you didn't present us what is the solution for this problem. For instance, the awareness sessions, it can be initiated by schools, by civil society institutions, by psychiatry, by any institution or organization can make change in this area. And for the decision process, I would like to find another label for decision to be not separated from the pain. For example, painfully decision, because even in the decision process, we have pain to take the right decision. So for me, I don't like to separate the pain from the decision. I want to be the two words that initiated that the decision is a pain.
How would you like to put it?
I don't know, but maybe we can find another label for this, another terminology. I mean, so but pain should be always stick to the decision.
Yes. So if I understood your question, so let me start with the last part. If I understood your question right, so pain is always, yes, pain is always stuck to decision, because pain can bring the best out of you or the worst out of you, right? And that's going to be your decision. That's where you have to decide which track you have to take.
Exactly. Right? So we can add something to indicate the pain with the decision. That's what I mean.
Yes, we can. Now, as long as the core meaning of the idea, you guys understood it, that's fine. And any of us can use any terminology they want to use, as long as we're all on the same page of the core meaning of it, right? Yeah. And regarding your first question, we are actually trying to really spread awareness regarding parenting styles and all of these things. I actually have YouTube channel that I started 1 year ago, and I'm trying to do that. In the center, we also provide parenting sessions, parenting training, parenting workshops. But the solution to that is, as you said, the first step is that the parents change. So, and I'm sure once they're aware of how bad the situation can get, they will change. At the end, we parents, we don't own our children, right? We are their protectors, you can say. Like God gave us to them so we can protect them until they can actually stand on their own feet. So if, for example, my child I can see that she is or he is putting an effort into studying, but she is not getting the grade she wanted, or she's not gonna. Some parents actually, their children are getting good grades, but they're used previously to the very high grades. So it's just like a change in the level of grade. Like instead of she was an A student in school, now she's a B student in college. Okay, so the pressure on her would be, why you're not an A student, right? So at that moment, I wouldn't say that when our kids reach college, we shouldn't be very picky on these things. Okay, at the end, all of them are going to graduate. As long as they're not C or D, they're going to graduate. Okay, and as I told you, I'm giving you an example. I was not an A student in college, and here I am. I love my career. My patients love me. I was able to be very successful in practical life. Okay, so don't judge your children that because their grades are not as before, like they're not A, now they're B, it means they're not going to be successful in future, right? Just even if you want to push them, just do it in an encouragement way. Okay, so now she's coming and she told you, I didn't do well in my test. Tell her it's okay, just one test. I could see that you did very good. You studied very well, but maybe we should talk about maybe that the way you study is different. Maybe, mama, you got used to study this way and you should change it to this way. Maybe if you speak to your mentor, you speak to something, but I'm always proud of you. I'm always gonna be there for you. Just one test, don't let it get into you. You're able to do it, you're strong, whatever you're gonna say it to your child, whatever goes out of the parents' father or mother mouth is gonna reach to your children. They're gonna do that. Okay,
thank you so much, Dr. Sanabel, for the very insightful answer, all encompassing. Actually, I see a question by their Vinod Roji from South Africa. And his question is, as a psychiatrist, did you at any stage in your life feel hopeless and even sought outside help?
What was the last thing? If I sorted outside help?
If you looked for any outside help yourself.
Okay, so that's for me as Sanabel, not as a okay. So see, usually, yes, I got very hopeless at many stages of my life. Okay, I'm gonna tell you something very personal. I'm a mother who always gets postpartum depression. Whenever I get pregnant, I get depressed. I love my children and everything. I just cannot take the hormones. Okay. So at the first time, actually, I didn't realize it. See, you could be actually a psychiatrist and you just don't realize that you're depressed. So the second pregnancy, I realized it right away, and I started medication during pregnancy, continued it for another 1 year and a half, I think, and then I tapered it down and I'm off. I took it off after that. But see, even if you are a doctor, even if you are, a professor, we're all human beings. We're all vulnerable. We can all pass through difficult times where we're hopeless. The point is, you realize that you're hopeless. You realize that you're hopeless, and I need to talk to somebody. So at some point, I used to ask for like outside help, as in, like in Qatar, we only had the HMC. So these are like my friends and my colleagues. So yeah, some of them I actually seeked help from them because you can't prescribe medication for yourself, you know. And yeah, so I did. So it's totally normal. It's fine. Don't feel disencouraged. It's okay.
Thank you, Dr. Sanabel. And one final question there, Tekang, please kindly share your question briefly. And that will be the last question for the day. And we'll thank Dr. Sanabel for her contribution for today. Yes, Tekang.
Okay, thanks very much. Hello, doctor.
Hi.
My question, permit me to say that the issue concerning mental health has been kind of a buzzword when it comes to the issue of the virus, probably 2020 right up to now. Within 1 year, there's much talk about mental health. So I want to find out from you, why did this issue not preoccupy or occupy us in the past 4 5 years before, prior to today's outbreak of the virus?
So your question is why do you think mental health was significantly affected by the pandemic, right?
Why mental health wasn't spoken about in the past 3 or 4 years before?
Now, I see.
Now we got the virus, and any corner of the world you get the issue about mental health, which I think is very important and significant, particularly at this point in time and continuously.
Yes. So see, in the stigma of mental health or psychiatry in general, it's there everywhere in the world. Now, some countries are much more advanced, like they went through the road faster than other countries. Now, in this part of the world, Arab countries, you will still have people who are coming like from background, like our grandmas and stuff. Some of them are not educated, right? Some of them you would find they're still stuck with the previous culture where, if somebody goes to a psychiatrist, it means you like that person is crazy or something like this, right? I would say that we as doctors, actually, we did not do our job properly in fighting the stigma. Actually, some studies, it shows that the people who spread the stigma mostly are psychiatrists. Why? Because if I'm a psychiatrist and I'm working under a hidden umbrella, like if you notice here in the private sector, there are a lot of psychiatrists in the private sector, by the way, but they're all hidden under an umbrella of like a polyclinic or a general medical, or I don't know, a hospital or something. And they're not being advertised even for, right? So that means me as a psychiatrist, I feel ashamed working as a psychiatrist. And that shouldn't be the case, right? If that was actually one of the main problems why I intentionally called the center Specialized Psychiatrist Center, because I wanted to be out there. Okay? I wanted to reach patients and reach a point with them where they can come not feeling ashamed, happy coming. They're able to face people who are saying these things and stuff like that. So we're working on that now. Then the pandemic actually opened a lot of eyes that this is a real situation and a very important thing, and we need a lot of awareness and specific talks about these things. So the pandemic actually has some positive stuff.
Thank you so much, Dr. Sanabel. We are so grateful, and we are really honored to have you today. Dear audience, everyone, tomorrow we will be having our final, the end actually, and we will be having actually our youngest speaker, El Anud El Hitmi. She is 12 years old, and she'll be talking about the plastic pollution. And also tomorrow, one of the highlights actually is that one of the organizers there, Bayan Khaled, a very ardent activist for the Palestinian cause, actually, she'll be sharing with us a really inspirational poem. And so tomorrow, please stay tuned, same time, same place, same link. And we are grateful to all of you who made this possible. And once again, special thanks to Dr. Sanabel for today. And we wish you a pleasant rest of the day, a blessed end of the Ramadan, happy iftar, and siyam makbul inshallah. Ma salama.